Good morning, students. Our next chapter name is the revolutionary step in surgery. In the 4 units, second chapter name is the revolutionary step in surgery. Surgery surgery date back to as early as 600 BC. Sushruta Samhita is one of the oldest work in the world dealing with surgery. It indicates that Sushruta was probably is the first surgeon to perform surgical operations. Later, some ancient surgeons performed teeth extraction and bloodletting. Major surgery could not develop for centuries because of lack of knowledge and technology. The doctors had to cut open the part of body that was not healthy, remove it or set right that part. This would involve a lot of pain to the patient. General anesthetics like either or the either or the chloroform developed only from of the mid 19th century, making painless surgical operation possible and successful. Modern techniques are used nowadays for an anesthesia. General anesthesia blames the whole body and it is used for surgery of any region of the body. For local anesthesia, local anesthesia and anesthetics are the injected into the surgical spot on an area near the nurse. Over the year now, a revolutionary step has been taken in different of the complicated surgeries, and these have made such a operation successfully. Let us start with the cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctor did not have modern medical tools and procedures essential for the heart surgery. In those days, heart patients were treated with the sedatives and they usually did not survive. Then in 1893, Daniel Haley Williams, a young African American surgeon, attempts to new medical technique in order to save the patient's life. The patient James Cornish was the suffering from the very serious knife wound. The knife had cut an arteries less than an inch from his heart and punctured the pericardium, the sac around the heart. Dr. Williams, with 6 staff doctors, performed the complicated and daring operation. Dr. Williams became the first surgeon to save his patient by successfully repairing the human heart. Here given the hard word. Here given the hard word in this topic is the bloodletting. Bloodletting means or revolutionary word. Here the in this perform the bloodletting means to drainings outwards. Then revolutionary, that means surgery does not back in 16th Sushruta Samhita, one of the oldest dealing surgeries, indicates Sushruta was the probably first surgeon performed surgical operations. That means here given this to revolutionary means causing a total dramatic change. Then unauthentic means substance gases that make one feel to pain. Then venomous means to make nerves so that one does not feel any pains. Cardiac means related to the heart. Essential means to necessary. Then sedative means to substance that makes someone sleepy. Here start surgery date back as to early as 600 BC. Sushruta Samhita, one of the oldest work in the world dealing with surgery. That means surgery is back early in how many years? To 600 BCs, and Sushruta Samhita is one of the oldest work. That means Sushruta Samhita is the doing work on this field, and which world this surgery. And later some ancient surgeon performed tooth extraction and bloodletting. That means some surgeons who was the ancient surgeon who was performed the extraction and the bloodletting means to draining out of blood. Then major surgery could not developed for centuries because of lack of knowledge and technology. Major surgery could not developed in centuries because the lack of knowledge and technology. That means the lack of knowledge and technology म्हणजेच नॉलेज काय होतं कमी असल्यामुळे ती डेव्हलपड तेवढी झालेली नव्हती. द डॉक्टर हॅड कट ओपन द पार्ट ऑफ द बॉडी दॅट वॉज नॉट हेल्दी, रिमूव्ह्स or set right of the part. They would involve a lot of pains to patient. That means any related to any patients, the doctor had cut open the part of the body and then again set this part of the body, remove it or set right that part. The would involve a lot of pain to the patient. That means at that process the lot of pains the patients. Generally unauthentics like either or chloroform developed only from of the mid 19th century, making painless surgical operation possible and success. Unauthentic substance or gases that makes one feel no pains. That means आपण भूल म्हणतो की नाही, भूल. And authentics like either or chloroform. That means in the time of surgery, today's in the modern age, the doctors who was used the injections of the chloroforms, that means the substance that makes one feel no pains at that time of surgery. पेनलेस सर्जिकल ऑपरेशन पॉसिबल अँड सक्सेसफुल. आपण काय म्हणतो त्याला भूलाचं म्हणतो. दॅट म्हणजे डॉक्टर जे काय भूल देऊन आता ऑपरेशन करतात की नाही त्या पद्धतीनं. दॅट मीन्स ॲट दॅट टाइम in the 19th century these are the unauthentics like either or chloroform developed, and with the help of these the painless surgical operations possible and successful. The next para, modern techniques are used nowadays for the unauthentics. General anaesthesia. Venous means to make nerves so that one does not feel any pains the whole body, and it is used surgery of any region of the body. That means in the modern technique that are used nowadays for the anaesthesia. Generally anaesthesia nerves to whole body. म्हणजे त्या होल बॉडीमध्ये काय केलं जातं म्हणजे आपण भूल म्हणतो की नाही त्या पद्धतीनं दिली जाते. अँड इट इज युज्ड सर्जरी ऑफ एनी रिजन ऑफ पॉट, अँड दिस इज द युजफुल फॉर द doing the surgery of any part of the body. For local anaesthesias, local anaesthetics are injected into the surgical spot and area near the nerves. म्हणजे एक at the time of the surgery, these anaesthesia or local anaesthetics are injected in this surgical spot. म्हणजे त्या सर्जिकल स्पॉटला काय केलं जातं, जवळ कुठे तर इंजेक्शन दिलं जातं. Then over the year now revolutionary steps have been taken a different type of complicated surgery, and these have made such operations successfully. That means today's revolutionary step has been taken a different type of complicated surgeries, and these have made operations successfully. That means revolutionary step have been taken different type of. Over here now revolutionary step has been taken in a different type of complicated surgery. That means at that time there are very different or complicated surgery takes place because of modern age have made such operation successfully, and this operation is successfully done. Let us start cardiac surgery. Cardiac means to related to heart. Now today if you needs have a heart surgery, you can choose from many fine doctors. However before. That means let's start the cardiac surgery. At the surgery of the heart today, if you needs to have a heart surgery, and many doctors are available at that time. That means modern time many doctors are available for this surgery. However, before in 1893 the type of surgery was unknown. That means before time of the 1893 this type of surgery was unknown for everyone. Doctors did not have modern medical tools and procedures. That means this period the doctors did not have modern medical tools. That means not the facility available of the surgery and procedures essentials to means necessary, essential for a heart surgery. In those days heart patients were treated with a sedative and they usually did not survive. That means at that time, that means before in 1893 the important material not available at that time for the surgery, and because of these where the heart patients were treated, heart patients were treated with a sedative and they usually did not survive. Then 1893 Daniel Halley Williams, young African American surgeons. That means in then 1893 the Daniel Hale Williams, who was the young African American surgeons, attempt new medical techniques in order to save patients life. That means who is the first start in the medical techniques in order to the patient's life for the surgery, the Daniel Hale Williams, a young African American surgeons. Then next the patient James Cornish was suffering from a very serious knife wounds. The knives had cut an artery less than the inch from his heart. That means the patient, the first patient of this Daniel Ellis, the James Cornish, was suffering from the very serious knife wounds, and at that time the patient was very serious knife wound. The knife had cut on artery less than an inch from his हार्ट. दॅट मीन्स पहिली त्याने सर्जरी जी केली ती हार्टची किती केली तर त्याचा हार्ट किती कट म्हणजे हार्टच्या इथं इंच फ्रॉम हार्ट अँड पंच्ड द पेरिकार्डियम्स. दॅट मीन्स सॅक अराउंड द हार्ट म्हणजे सॅकच्या अराउंडला काय झालं तर कट झालेलं होतं. डॉक्टर विल्यम्स विथ 6 स्टाफ डॉक्टर. दॅट मीन्स ॲट दॅट टाइम द फर्स्ट सर्जरी वॉज doing the Williams with his staff doctor. 6 staff doctors performed a complicated and daring operation. Dr. Williams became the first surgeon to save his patient. That means at that time the Dr. Williams was the first surgeon who is successfully repairing the human's heart. Now many more advanced techniques are used in the specialty to deal with the heart complications. Open the heart surgery, which can help repair heart defect, heart walls, and even replace them. In also performed successfully with the proper measures, patient can recover from the cardiac surgery faster than they did before. That means now many of more advanced techniques are used for the specialty. That means today's time the many advanced techniques used for this specialty. The heart complication, open the heart surgery. That means today is the surgery which can help repair the heart defect, heart's walls. That means they used for wall means to device for the allowing flow in one direction only. Today's in modern eras they repair the heart defect, use the heart walls or even replace replace them. In also perform successfully with a proper measure, patients can recover from the cardiac surgery faster than they did before. Then next neurosurgery. What is the neurosurgery? The surgical specialization that treats disease and disorder of the brain and spinal cord. That is neurosurgery is related to the brain or spinal cord. In another recent especially to have received recognition since the early 19th centuries. It was concerned with the treatment of disorders of the nervous system. Disorders here the health defect. That means in the neurosurgery is the another recent specialty to have received recognition since in early 19th centuries. It was a concern with the treatment of health defect of the nervous system. That the neurosurgery is related to the nervous system. Neurosurgeons operate the brains, the spine or the nerves. They can treat patients of all age from the newborn to the elderly who has suffered a stroke. That means the neurosurgeons who was operate the patients from the newly born baby to the elders. Elders who suffering a stroke. Harvey Choosings in 1869 and 1939 is considered to be the father of modern neurological surgeries. In early part of the 20th centuries, he developed basic techniques and instruments for the operating on brain, distinct surgical specialty, choosing dramatically reduced the mortality rate of the neurosurgeries from 90% to less than 10%. By the time of the retirement in 1937, he had successfully removed more than 2,000 tumors. That means this neurosurgery is related to the spinal cord or nervous system and brain. Harvey's choosings in 1869 to 1939 is considered to be the father of modern neurological surgery, who is also known as the father of modern neurological surgeries. Harvey Choosings, also known as the father of modern neurological surgeries. In the early part of 10th centuries, they developed a basic technique. That means in 10th centuries, they developed many techniques and instruments for the operations. And based on this instrument, choosings dramatically means to suddenly and successfully. Dramatically, choosings suddenly reduced the mortalities. Mortality means death or death rate. Mortality means death rate. That means they reduced the death rate of the neurosurgery from 90 to less than 10%. That means they reduced the death rates neurosurgery from 90 to less than 10% by the time of retirement in the 1937. That means at the period of the retirement. In the time of retirement in 1937, he had successfully removed more than 2,000 tumors. Tumors means abnormal or extra growth. The main reason that mortality rates had been so high before was the blood loss. Among choosing significant achievement are the method of development of steam. This blood loss by the investing clips called silver clips or the choosing clips. The steam is control. That means the main reason of mortality. That means the main reason of the death rates had been the high before the blood loss. Blood loss होणं हे काय होतं त्याचं मेन रिझन होतं डेथचं. अमंग चूसिंग सिग्निफिकंट अचिव्हमेंट आर द मेथड ऑफ डेव्हलप्ड आणि ती मेथड कुणी डेव्हलप केली चूसिंगनी डेव्हलप केली. स्टीम मीन्स टू कंट्रोल here given the word stream or control this blood loss by investing a clip called as the silver clip or choosing clip, and this is known as the silver clip or the choosing clip. The neurosurgeons is one of the most cutting edge in the world of surgery and medicine. That means here given the cutting edge means latest development. The neurosurgery is one of the latest development in the world of surgery and medicines. What is the robotic surgery? Robotics means surgery carried by minimum surgical instrument. What is the robotic surgery? That means in this surgery they are used or carried by the minimum surgical instrument or material. Robotic surgery is type of the mainly invasive surgeries. Invasive surgeries, that means invasive surgeries. Minimally invasive means that instead the operation on patient through the larger incisions means surgical cut made the skin or flesh. Use of the mode of the miniaturized means to made very small size miniaturized surgical instrument that fit through the series of quarter inch incisions when the performing surgery with the De Vinci, the world's most developed surgical robot. These miniaturized instrument or mountains means here set up uh, separate robotic arm allowing the surgery maximum range of the motions and the precisions. The De Vinci fourth arm contains a magnified high definition 3D camera that guides to the surgeon during the procedure. That means the robotic surgery means the type of the minimally invasive surgeries means minimally invasive means that instead of operations of patients through large incisions means to surgical cut made by skin or flesh. This made in the miniaturized means small in size and instrument, that means the surgery which used the very few instrument and they used for the surgeries. First surgeries, the De Vinci fourth arm contain magnified means to enlarge high definition 3D camera guide for the surgeons during the procedure. म्हणजे जे सर्जरीमध्ये काय केला त्यांनी 3D चा कॅमेरा काय केला पहिल्यांदा यूज केला. The surgeons control this instrument and they camera from the console. That means in the surgery the surgeons control the instrument and the camera consoling for the located in the operation room. This camera located on this operation room and this console that means combination of display input device and control mechanism used for the controlling robot. Room, placing his finger in the master control, he is able to operate all four arms through the winches while looking through the stereoscopic high definition monitor. The robot literally places the surgeons inside the patients. This give him the better, more details 3D views of the operation site than the surgeon's eyes can provide. Every movement he makes with the master control in the replicated accuracy by robot. When necessary, in surgeon can be even change in scale and robot movement. If select the 3:1 scale, this tip of the robot's arm will be moved just 1 inch every inch that surgeon had moved. That means replicates means to made an extra copy. That means with the help of this robot the operation all four arm of the inches while the looking through the stereoscopic high definition monitor. त्याच्यावरती हाय डेफिनेशन मॉनिटर काय केलेला होता सेट केलेला होता. रॉबर्ट लिटरली प्लेस्ड द सर्जन्स इनसाइड द पेशंट्स. तो कुठं बसवला जात होता तर बेटर देन सर्जन्स they literally place the surgeon inside the patients. This give him a better, more detailed in 3D views operation site. आणि तो कुठं काय करत होता give the views of operation site then the surgeon's eyes can provide. Every movement makes with the master control of replicates made of extra copy accuracy of the accurately by the robot. When necessary, surgeons can use change the scale of the robot movement. आणि जे काही सर्जन्स होते ते काय करत होते, काही सर्जन्स काय करत होते चेंज द स्केल ऑफ रॉबोट movement. Select 3:1 scale. This tip of the robot's arm will be moved just 1 inch. ती किती इंचानं हे मूव होत होती तर 1 inch every 3 inch that surgeon's hand मूव. आणि एवढ्या ह्यानं काय होत होती, for every 3 inch that surgeons have hands move. Utilized this advanced technology, our surgeons are able to performing growing number of complex surgical procedures. Since this procedure can now be performed through very small incisions, our patients experience a number of benefits compared to open the surgery the past. That means in the modern age, the surgeons who is use the many of the modern techniques. Thank you.